Hi, I'm Dr. Shah from Hill Country Plastic Surgery.
And I'm Dr. Farber.
Today we're going to talk about breast reduction. The first question is, what is the difference between a breast reduction and a breast lift? And based on the name, you can guess that with a breast reduction, we are removing a significant amount of breast tissue in order to relieve the weight and the issues that it causes, like neck and back pain, and also to lift up the breast and put it back on your chest. With the breast lift, we're also lifting up the breast, we do remove a little bit of tissue, but it's not a significant amount. Usually your breast size is about the same. It's just a different shape and also a different position. So with a breast reduction, there are a lot of medical benefits with it. And the line between a breast lift and a breast reduction, it's kind of blurred. There's no real definition of what one is versus another. But if you're going through insurance to cover your breast reduction, they actually determine how much to take off, and there's a hard line.
Well, so there are two different ways to get a breast reduction. One is through insurance coverage, and the other is through private pay or cosmetic. So in order to get it approved through insurance, there's a number of things that have to be done. So number one is you need a referral from your primary care doctor or OBGYN, which is pretty common as well. They have to document that you have macromastia, which is, for medical term, for large breasts. It has to be symptomatic. So what does that mean? So you have to be experiencing back pain or neck pain, rashes underneath your breasts, shoulder grooving from your bra straps digging in. So if you're experiencing any of these, that's considered symptomatic macromastia, and insurance typically will cover that. So, however, each insurance company has kind of their own arbitrary way of determining how much breast tissue we need to remove from each side. So that's based on your height and weight, your body surface area. They have all these little calculations that we have to do in order to determine what will be approved to be removed. So on some patients, they require us to take off a large amount of breast tissue. So if you're smaller chested, that may mean that you're not left with much breast tissue or much breast after the surgery. So that may limit you in terms of the insurance route, but there's also the other route, the cosmetic route, which will allow you to get the breast shape and size that you want. And Dr. Shah will talk on that.
So for a cosmetic or self-pay breast reduction, it doesn't mean that you won't get the same functional medical benefits of a breast reduction. You'll still get neck and back relief. The breast will still be lifted. It's just not covered by insurance. And unfortunately, sometimes the insurance company, they make the rules about it. So if you're going through the self-pay route, the benefit of doing that is that you get to determine how much breast tissue you want removed. And it can be a little bit, it could be a lot, but the main goal is to be able to get you to where you want to be. Most of the time, patients are wanting to be proportional to their body. And we size the breast and how much we take off, not just by cup size. The difficulty with cup size and bra sizes is that you get them one, like say Victoria's Secret versus something you get from the department store, and it's the same breast size, but they're completely different cup sizes. So what we actually do is get pictures. We want to see what a certain breast size means to you. And then once we understand what you want, then we do the surgery to fit your needs. So that's the main part about doing that.
Right. Let's talk a little bit about how it's done. So a little bit about pre-op. So preoperatively, if you're going through the insurance route, we want to get a note from your primary care doctor or OBGYN, and you need documented symptoms from them as well as for us. Typically, we also take pictures during consultation in order to send to insurance, so you can expect that to happen as well. If you have a family history of breast cancer or you're over the age of 40, we typically require you to get a mammogram prior to your surgery as well. Your surgery is an outpatient surgery. Typically takes about 2 hours or so. And we don't use drains. The incisions are what we call the Wise pattern or the anchor pattern incision, and that goes around the areola straight down in the fold, so that's what you can expect. And through that, we remove the excess breast tissue and skin, and typically we do send that off to pathology just to make sure that there's nothing concerning with the breast tissue that we remove. And afterwards, Dr. Shah will talk about postoperative expectations and care.
So after surgery, like he said, we don't use drains, so all you have are surgical dressings on all of the incisions. Then you will be in a post-op bra. We provide it for you if you're going the self-pay route, and if you're going through the insurance route, usually the hospital provides it. But you'll be in a type of bra with a front closure for about 6 weeks. Immediately after the procedure, then you'll start swelling. So it may seem like it's still too big right after surgery. And then after the first 3 days, then the swelling starts coming down. You won't see your final results actually until about 9 to 12 months after surgery. It takes time for the skin to relax, for the elasticity to really accommodate the new shape. And right after surgery, it may look a little crazy. It's going to be high and tight, and then everything will loosen up. Usually about 3 months after surgery, you're going to see the basic breast shape, but the final results and the final softening of everything doesn't happen until much later.
We can talk about additions to the surgery too.
Oh, yeah. So some people have a little extra on the side. If you have hanging skin, then that's something else we need to talk about. But if you just have a little bit of extra tissue on the side that's making you look a little wider, we can do liposuction at the same time as the breast reduction. And it's a great thing to add. We can also do it over here in the armpit. Oh, and the place that everybody really likes is right here, that part that hangs over your bra. So we can get over to this area, and people really like getting some of that fat taken off. So liposuction is not covered by insurance, but it can be done at the same time as the breast reduction. Also, if you wanted to do a cosmetic procedure, for example, you wanted to do your arms or your thighs or your abdomen or something else, and that's not a insurance procedure, we can still do it. So we do breast reductions along with abdominoplasties or other surgeries. We do it quite often.
Yeah. As a mommy makeover, we could do a breast reduction through insurance, but your tummy tuck not through insurance. So we can often do these combination cases. We do them quite frequently.
Yeah. You want to talk about frequently asked questions about this?
So I think a lot of patients ask about what's their scar going to look like, but like we discussed, it's going to be that wise pattern scar. What can be, and also they ask what's my recovery like? What's my activity restriction? So typically we tell patients 4 to 6 weeks of limited activity, so no strenuous exercise or lifting more than 20 pounds. After your surgery for about 4 to 6 weeks, you can do normal day-to-day activities like driving as soon as you feel up to it, running HEB, running errands, housework, that sort of thing. So that's pretty straightforward. And then, in terms of pain, we give you great pain medication during the surgery and after the surgery. You're going to have pain. You're going to be a little uncomfortable, but not a terrible amount of pain. Most patients are off their pain medications within 2 to 3 days.
Yeah. The other question that we get is, can you make the nipples or the areola smaller? And yes, we can make them as small or as big as, well, up to a point as you want. Usually they're about 4 centimeters in diameter. And the other question is a lift included with the breast reduction? That is part of the procedure. So yes, it is lifted. It's not a separate procedure.
Yeah. And that's it. That's breast reduction 101.